Yeah, so I was 21 years old when I became an HPRS scholar, one of the youngest members of the cohort and in the program. And initially, this was really intimidating, just being surrounded by scholars who were older, wiser, and seemed to be further along in developing their professional and academic identities. Um, while I was still struggling to figure out who I was and the type of researcher that I wanted to be. So, I watched and I listened to the other scholars. I listened to how they talked about and approached their work. I listened to them discuss the type of impact that they wanted to have and how they engage their communities. And for them, I realized that it was personal. It was bigger than a degree. It was bigger than simply publishing an academic article. Their central goal was to improve the conditions of their communities. And for me, this had a profound impact on my mentality and how I approach my work, because typically as researchers, we're taught to be detached and remain objective researchers. But for many scholars, particularly scholars of color, that's not the goal. The goal is to leave our communities better than they were before. Yeah, so prior to becoming an HPRS scholar, I had a very specific and limited view of what constitutes a leader, right? I thought a leader, had to be like charismatic, be at the forefront, be outspoken, influence and inspire others. But HPRS really helped me broaden my view and help me realize that everyone is a leader. It's just about identifying your strengths and identifying where and how you can have the greatest impact. But most importantly, it's about helping others kind of identify and maximize the use of their strengths. So this new understanding of leadership I've brought to my collaborative work. I no longer feel pressure to be at the forefront because that's not my leadership style. I'm comfortable with someone else being outspoken, delegating tasks because I know that I can contribute in other ways. For example, bringing new ideas, helping others think outside the box, making others feel valued and appreciated. And these are qualities that are essential to any group's success. The first piece of advice I'd give is to make a concerted effort to meet people and establish connections. As an HBR scholar, you'll have access to a large, resource-rich network, and engaging that network can really open up a lot of opportunities. The second piece of advice I'd give is to do more than the bare minimum. So, as a scholar, you'll be expected to fulfill core requirements to successfully complete the program. But HPRS also offers a variety of additional opportunities that can supplement the core teachings of the program. For example, statistical programming workshops, book clubs, writing retreats. So it's important to really take advantage of that. And the final pieces of advice I'd give to future scholars is to be open to the process, right? Developing a deep understanding of who you are as a leader is a long and arduous process. It requires a lot of critical self-reflection, which can be difficult and uncomfortable at times, but necessary to really understand who you are as a leader. So it's important to be open to that and really lean into the process. Yeah, so my vision for building a culture of health in my discipline and my community involves being intentional about connecting my work to policy to promote health equity. So the ultimate goal is that everyone, regardless of sociodemographics such as race, education, income level, has the opportunity to live long and healthful lives based on their own definition of what constitutes good health and a healthy lifestyle. Sociology graduate programs don't teach students to engage in translational research or develop policy implications. And consequently, research on health disparities is seldom translated into policy and practice. And sociologists rarely have opportunities to engage in policy discussions. And HPRS fills this training gap and teaches scholars to develop research that produces action. And participating in this program for me has provided me with the tools necessary to develop evidence-based policies that will contribute to a healthier and more equitable future. Coming into the program, I wanted to learn how to have an impact with my research. And HPRS certainly provided me with the tools and knowledge necessary to do that, right? It began with just being surrounded by like-minded people who wanted to have an impact in their communities. And through things like course lectures, applied learning experiences like the case competition, for example, or policy pitches, and just discussions with the HPRS faculty who have done the work has really instilled the confidence in me that I too can make a difference and have a lasting impact on my community through my research.